Hi, this is Angela with New Health, and I'm here today to show you how to draw up your medication from a vial. First off, you want to start with clean hands, so either just have washed your hands or hand sanitizer. I am going to use gloves today, but if you do not have gloves, that is okay as well. Just keeping it all sterile. So what you're going to get from the pharmacy is going to be a vial. It's going to be much smaller than this, depending on the size of the vial. But here is what it's going to look like, is it's going to have a cap on top of it as well. You're also going to get some different syringes, potentially ones that look like this, or potentially larger ones, but it's all the same kind of process. What you do want to remember is to refrigerate this medication after we draw it up, before, after, during, all of it. Just make sure that when you're finished drawing up the medication today that you put it back in the fridge. The other thing is that we are talking about both types of different medications. So we have the semaglutide that we have ordered, which is the generic for Wegovy or Ozempic, or we also may have ordered you the tirzepatide, which is the generic for Mounjaro. So both would work in a similar manner. Additionally, we have emailed you the dosing sheet. So what dose you're supposed to be on. We're going to email you that dosing sheet, and then you'll be working with your provider on what dose to be taking. So the first step would be, of course, the clean hands, and then you're going to take your vial. There likely is going to be a cap on it, just like this. Now you can see there's a rubber kind of cap, or excuse me, a rubber area. That's where we're going to be injecting the needle. So you're just going to hold this like this, take the syringe that you have, the syringe and needle, and then you just put that down in the rubber area, and then pull the vial up, upside down, and then pull down on the plunger to the appropriate dose. In this case, if you're supposed to be getting, let's say 17.5 units, then you would just go in between the 15 and the 20, there in the middle. If you're supposed to be getting 30 units, then you pull it down just so that the plunger is right at the line of the 30. And then you can tip it back up, pull out the syringe, and then if you're not ready to give it to yourself, you can carefully recap it. Or if you do plan on go ahead and giving it to yourself, you're welcome to go ahead and do that now as well. In the future, when you're pulling out additional dosages, make sure that you have an alcohol pad to clean the area after, because this time we didn't do it because we just had the cap on it. Additionally, there is going to be a best by date on here that says used or discard after 28 days. That's just for vials in general. That's not for this medication specifically. Vials in general, the pharmacies and pharmacists say that they shouldn't use after 28 days. We know that the medication is good for much longer than that. It should last you 2 to 3 months. If you have any additional questions, you're welcome to text our main office line at 785-215-8228 with your questions about your vial. Additionally, moving forward, we want to make sure that we know when you're about to run out of your medication. As you know, the delay time is about 4 weeks for getting the medication. That may vary depending on as we progress working with them. But let us know when you have a month left. We need to know so we can get that ordered. Thank you so much for your time today, and we look forward to working with you in the future.